Hey guys, Gretchen Zablocki here for your Wellness Wednesday, and today we are at the Abundance Wellness Center with Dr. Bunsic. And so our August blog on diabetes is up, so you guys can take a look at that. And then we just wanted to get together with Dr. Bunsic today and talk a little bit about some dietary changes you can make, and then also some things that she does here at the Abundance Wellness Center to help treat and manage your diabetes. So tell us a little bit about the dietary changes and things that patients can do to help.
So one of the things I really like to start out educating all my patients, and anytime I give informative talks about diabetes, is actually how powerful diet can be in the treatment of diabetes. I think that because in medical school we focus a lot on pharmaceuticals, that a lot of times our treatments tend to gear towards pharmaceuticals, and we tend not to emphasize enough the lifestyle change studies. So actually, it's been well known for decades how powerful it is. However, because it's so difficult to get people, like I can't make you change all of your lifestyle as easily as I can try to get you to take a pill, those things have often been underemphasized in the medical dialogue between physician and patient. So that's one of the things I typically start out with, and just really informing people about how powerful it is, because I think having that knowledge is power as a patient, because it's hard to change your lifestyle if you don't think it's going to make a lot of difference. But if you know that you could get off one, maybe two medications, or never have to take them at all with all the side effects and the cost, then that's something that can be really motivating for people.
Absolutely.
So they've actually done studies that showing some significant dietary change. So that's basically cutting drastically the carbohydrates in your diet, which are what convert to sugar, which of course elevated blood sugar is diabetes. Once you pass a certain threshold, and in the in-between zone, a lot of people now are suffering from pre-diabetes. So these same type of changes would be also applicable to them, which is a nice percentage of the population. They've actually showed that it's as powerful in diabetics as taking 2 different medications.
Wow, okay. Wow. And so, just for clarification, fruits are carbs.
Yes.
So many people are like, it's fruit, it's free, I can eat it.
Right.
But
and so it's kind of funny, because a lot of times I tell people it's a misnomer, fruits and vegetables. It should very much be vegetables and fruits. So when people say, I'm doing great, I'm eating all of these clean foods, I'm eating a lot of fruit, I'm eating some vegetables, I tell people, well, really it's more, you should be eating mainly vegetables and a select amount of fruit, especially if you're a person who tends to be, in the overweight or obese category, which automatically means you have probably some component of insulin resistance, which means anything that's a carb, such as fruit, is something that also will raise your blood sugar and can be then stored as fat in your body. So that's another confusing point that a lot of people have, is like fat versus carbs, where a lot of people think that they should still be on that low-fat diet. In the 80s and 90s, the government and the nutritional associations really push more of a grain-based diet, moderate protein, but actually very low in fat. And at that time, we didn't have a lot of scientific understanding of the different types of fats and good fat versus bad fat, the fat requirements that your body actually has. So I like to inform people too, all of your cells are actually coated with a fat membrane. It's called a phospholipid membrane. And so you have to replicate new cells all the time because of normal cell death, plus of course, other issues that occur in the body with healing. So it's really important that you actually get in good fats in the diet. So those are things like, your avocado, your coconut oil, your olive oil, and nuts and seeds. So you want to be incorporating still those foods into the diet as well. And that also helps satiate you and not make you feel as hungry all the time and get into that carb craving cycle. So I totally agree. You want to try to definitely lessen your total carbohydrate load and then balance that out with the proteins and the good fats. One of the main things I do with people is really teach them about carb counting, and I'm sure from the fitness variety you're familiar with that and doing some personal training, I know, as you've done in the past. So one of the things that's really important to learn is like what what is a carb, right? So that is all your fruits, that is all of your starchy foods, potatoes, of course, breads. A lot of people kind of forget about rice and corn.
Yeah.
Those are also starchy foods. And then anything that is a fruit will have some starch. Now, it tends to be that the berries have less starch per fiber, so using them in moderation is usually okay for people who are diabetic or pre-diabetic, depending on how severe it is. Those who come in, some people come in on insulin plus 2 or 3 other medications.
Yeah.
In that case, we tend to go to the super low carb, getting into the ketogenic diet to basically shut down all that extra insulin production. Okay. So your body naturally has a basal insulin production. So the healthiest people that are not diabetic just naturally produce just a small amount of insulin, and it's a special type of insulin that's just meant to keep your metabolism and your body sugar stable.
Right.
So we want to maintain that, but we want to avoid what's called the insulin surges. So every time you eat a carbohydrate load, and typically that's over 30 net grams of carbs, which, by the way, net carbs are your total carbs that you're eating minus the grams of fiber. So like green beans have carbs, for instance.
Right.
So a cup of green beans has 6 grams of carbs, but 3 of those grams are fiber. So the net carbs per cup of green beans is only 3. Okay. So when you're going into a 30, but whereas a white potato, if you eat a small white potato, that's already probably getting over your 30 grams of carbs.
Yeah.
Because it's mostly starch, very little fiber in
Right.
there. Okay. So that's why you want to pick the green beans and not pick the potatoes.
Yeah.
And so if you keep that net carb load under 30 grams, you avoid that insulin surge. Now, people who are already into more severe diabetes, they tend to need to be even stricter. So it really, we tailor it to the person, where they're at in their disease state, what their other comorbidities or other conditions might be, because that will alter what their nutritional needs are. A lot of people also, after having diabetes for a long time, have a dysfunctional gut, where they either have overgrowth of candida because they've eaten so many carbs, and the body overgrows yeast to produce that creates other problems. But so we balance that out too. So all of those things kind of factor in. But in general, you're looking at trying to lessen your net carbohydrates, balance it out with protein, fiber, and your good fats.
Okay.
Yeah.
And then what else lifestyle changes can pre-diabetics or diabetics do to help?
So of course we talk a lot about exercise, and I think you probably know the statement that you can eat yourself out of any exercise program. So I do always like to start with diet, because I think it's important that patients understand diet is the beginning, middle, and the end, right?
Yes.
But another really important fact is a lot of people are maybe starting to engage in an exercise program, or maybe have been for a long time. I see a lot of people who are relatively fit, but they are still really struggling with their metabolism, whether it's with pre-diabetes or with diabetes. So one of the things that seems to really help them is building muscle mass. Yeah. So one of the things a lot of people don't understand is that your basal metabolic rate, which is the amount of calories that I'm going to burn just sitting here all day, okay, that is determined mainly based on your muscle mass, okay? Yeah. So if you're doing mainly cardiovascular exercise all the time, but you're not really doing the right diet and the right exercise program to also build muscle, then you may not be seeing the metabolic benefits. Now you're getting the cardiovascular benefits. Your heart's getting stronger and able to pump. You have, you're not getting winded. You're able to do more, but you're not seeing that reflected in the parameters in your body that you're hoping to. Nor are you losing the body fat percentage. And what a lot of people don't understand is that your body fat percentage has a lot to do with your metabolism, because your body fat itself actually produces insulin-like growth factors, estrogens, things that mess up all of your hormones and mess up your metabolism. Right. So those are things that need to be addressed as well. So it's all part of that global picture that we like to look at.
Yeah. So are you accepting new patients?
Yes.
And does somebody need to have a referral to come see you?
So typically, because I do both primary care and I do consultations for nutrition and osteopathic manipulation, so we could do it either way.
Okay.
So with or without a referral is fine, and I'm glad to share the information with their primary care doctor,
Okay.
or if they also have some primary care needs. And typically I'll do everything we do everything from a functional medicine perspective.
Yes.
So we're looking at all of the hormonal balance. We're looking at all of the lifestyle factors, and actually mind, body, spirit. So
Awesome. Love it. All right. Well, if you guys are struggling with diabetes or even just nutrition in general, are looking for some different lifestyle changes and looking to come at your health journey from, like she said, a mind, body, spirit angle, give us a call here at Abundance Wellness Center, and Dr. Bunsic would love to take care of you.
Thank
you
you
guys. Have a great Wednesday.
Thank you.